All right, I think we are recording. Gail, welcome.
Hi everyone. I'm Gail Kelly. I serve as the Executive Director for the Minnesota Head Start Association. And I guess now I can officially say I've been in that capacity about 19 years, but certainly not as long as Head Start has been around. And so sharing the history is somewhat of an honor for me, since this is history I've heard over the years from a number of different people. I was pretty little at the time, although I do remember 1964 and 1965 and many of the scenes from that time. So I will do my best to try to capture the essence of this great program in about 30 minutes, 35 minutes, and then if there'll be time for our discussion, I think. So, yes, it is the 55th anniversary of Head Start this year. Head Start was authorized the first time in May 18th in 1965 under the Lyndon Johnson administration to be a comprehensive health, nutrition, education program for children across the United States. And it's so fitting that we're doing this today, because in 1982, President Reagan proclaimed October as Head Start Awareness Month. So we are right dead center in the two anniversaries, I guess, in terms of talking about Head Start. And tomorrow our community will be doing a look back at Head Start over 55 years with Alice Dillon. So we are really excited about that opportunity as well, who's been with Head Start for 50 years. And I think the thing I can say very clearly is that the mission and the concept of Head Start has stayed the same over 50 years, and that is to provide an intensive, comprehensive child and family development program for low-income children, 0 to 5, and pregnant women. I will say that the early Head Start was founded under the Clinton administration, so in its origins, it was largely a preschool program, but it was for the whole family, so everyone was engaged. And as many of you know, Head Start's roots are in the war on poverty and the civil rights movement in the 60s. So here's a great picture, he's so handsome, of Sergeant Shriver, 1964, as he was named the head of the war on poverty by Johnson. He was responsible for the development of community action, VISTA, legal aid, and the Job Corps. And about a year later, in 1965, he developed a steering committee to launch Project Head Start with the honorary chairperson as Lady Bird Johnson, who was then the individual that got Johnson to put more money into the program, and was a lifelong advocate for the program. Shriver was very visionary, and he selected a group of visionaries with him to really develop the program. And that really showed the multidisciplinary foundation for Head Start with Dr. Ziegler, Dr. Cook, Julius Richmond, Dr. Gray, and Jules Sugarman, who were really the core team. And you can read a great book called The Hidden History of Head Start if you want to know how this team struggled with what elements they wanted to, and all the research that they looked at, the emerging research, to determine what this program should look like. And it really is in that root that we see the core elements. Head Start has always been grounded in research. The federal government has sought to, at that time, sought to compensate the inequalities in social and economic conditions in the development of this unique program for young children. And they knew that they had to encompass the whole family because poverty affected the whole family. So they had to figure out a way to bring family development with child development and make sure that it was addressing all aspects of what was creating those inequalities. And I think the thing that I love the most about the program, it was that they were really about community development. So if you were able to see the film we're going to see tomorrow about the beginnings of the program in Mississippi, you'll see that they really wanted the program to be community driven. And many of the components of the program, like the idea of having in-kind match, non-federal share, with volunteer hours, with parent policy council, those all evolved in the way to how can we bring the community into the program and make it a part of the program. But it wasn't until 1970 that the program actually developed. It was late 60s that program standards that really articulated the components, and particularly the component of the role of parents in Head Start. And that's where we saw the development of the Policy Council and really the evolution of how parents were to be involved in all the decision making, as well as the design of the program. And this just happens to be a current picture of the Tri-Valley Opportunity Policy Council, but it's really the parent-driven approach of this program that, that has stood the test of time and made it stronger. So the other essence of the program roots that we continue to still have is this idea that it is federal to local. So the Office of Head Start forecasts what funds are available to individual defined service areas across the country. And then grants are awarded directly to those communities. So they can be nonprofits, they can be public cities, faith-based organizations, for-profit agencies, but money flows directly federal to local. And then grants are awarded in 5-year grants now. That's changed a little bit, but with the idea that a successful grant should really understand the assets and needs of the local community and then leverage partners, resources, and parents to develop a comprehensive service approach for kids in poverty. Still today then, that federal local looks a little bit like this. So Congress appropriates the money, then the Office of Head Start out of Health and Human Services administers the funding, plans the monitoring system and the rules. Then we have 12 regional offices who are responsible then to work directly with local grantees to ensure the operational oversight. It's really the agencies, the grantees, board of directors that are responsible for the outcomes and compliance with the regulations. They empower a Head Start director to work on the day-to-day operations. And then the board and the policy council, parent policy council, work together to review, to sign off on program decisions, to monitor monitoring visits, and get ready for the next grants. So this is today the way this federal to local is administered. In 1999, the federal government added to reauthorization of Head Start the concept of a collaboration office. They wanted to create federal grants to go to states to provide an opportunity for the Office of Head Start to work directly with state agencies. So although federal Head Start operates outside of state government, the collaboration office is set up to help build, understand and build how Head Start fits into early childhood systems, to encourage collaboration, to really look at understanding how Head Start and the state can work together. And so in our state, that office is in the Department of Education, and Jeannie, who's on the call today, is the collaboration director. So the federal appropriation for Head Start is about $10 billion. Some people were kind of interested in, there are, in addition to the direct services money that goes for programming, there is about a 2.5 set aside for training and technical assistance that goes directly to the grantees. There's also research, demonstration, and evaluation money, monitoring support, program support, and DRS, which I won't go into much today, but it's the designation renewal system. And those monies all are administered by the Office of Head Start to support the administration of the program. In 2019, Minnesota's share of that pie was about 1.5%, or about 146 million. And as you all know, we also have been able to be one of the 14 states in the nation that has had state funding for Head Start. That funding was first appropriated out of general funds in 1987. And we have been able to hold on to that funding to serve additional children. So all the money for the state follows the same federal rules, but just allows us to add more children. The last 10 years, that state funding has remained fairly constant at about 12 million or 25 million a year. But we did, well, I guess it was 20 million a year. And in 2016, we had a $5 million increase. So as many of you already know, Head Start and Early Head Start are, their eligibility is income-based, but yet in the last three authorizations, or last authorization, many categories or risk criteria were defined as categorically eligible. So in a moment, I'll talk a little bit about the poverty guidelines, but we have categorical eligibility for homeless families, for children in foster care, and we require that the programs have at least 10% of their enrollment for children and this is infants, but all children with disabilities. We prioritize by risk criteria, since we are not funded to serve all children. So every program in the state has slightly different risk criteria, but largely these populations would all be highly eligible or high on the risk criteria for service. In the reauthorization 2007, we had a change to our income eligibility. So Head Start families' income eligibility is 100% of the federal poverty threshold. This is lower than Medicaid, it's lower than most federal programs. As you can see here, free lunch is at 130%, reduced price lunch at 185%. I think Medicaid is somewhere around 130. We did have a change, as I said, to allow us to serve up to 10% of children in areas of the state where we've reached all kids under poverty, to go up to 130%. But you have to be able to show the federal government that you have already served all those children that were income eligible at 100%. And I think my grantees always want me to emphasize the fact that we often serve families much below 100% of poverty, and degrees of poverty matter. And so children who are income eligible for reduced price lunch, their incomes are almost double what a family that's eligible for Head Start would look like. So here in Minnesota, big state, but actually considered a low poverty state. So we have 33 Head Start grantees, including 8 tribal nations and 1 migrant seasonal grantee. Most of the programs in Minnesota, with the exception of the programs in the metro area, serve funded enrollment of about less than 400 children. And as I said before, all the federally designated grantees are eligible for Minnesota's state funding. In 2019, we had a funded enrollment for Head Start around 10,500 kids, and Early Head Start around 3,200. We have seen a real increase in Early Head Start, even though this looks like a small number. This has been where the growth has happened in the last, I would say last 10 years. And we also started in, I think it's been at least 5 years, maybe even 6, that I have to ask someone, We've had early Head Start childcare partnership grants as well. And we serve around 380 infants and toddlers through that grant program. I think the thing that surprises a lot of our partners to think of Minnesota and look at our the diversity of the population we're serving. 55% of the children that we serve in Head Start are racially diverse, and a third of them speak a language other than English in the home. I told you before that we are required to serve 10% of our children with disabilities, and Minnesota always exceeds that. And last count, that was about 15%. And that's, when we speak of a disability, that would be eligible for early childhood special education. So they have to be eligible in 2 categories, as you know. And then 14% of the population we serve is homeless or in foster care. So it's a very high-risk population, far different than the average in Minnesota, and consequently, the reason why we need whole family and intensive programming options available. In the 2016 Head Start performance standards, the federal government changed what was considered to be the intensity and duration for Head Start programming. So they asked that people move to providing 1,020 hours of service to preschoolers. And, oh, you're going to get me. It's more than that for early Head Start, because early Head Start is year round. I'll remember it in a moment. I think it's more like 1,400 or 1,500 hours. So as a consequence, we have quite a few more programs that are serving full day center-based services, and that would be 4 or 5 days a week, over 6 hours a day. So part day was probably our biggest portfolio before 2016, and thanks to duration, now our full day services are growing fast. We also offer services in a family childcare model. We have home-based programming, probably more so in early Head Start than Head Start, but a few in Head Start. And then locally designed options, which are modifications of those various options, as well as early Head Start childcare partnerships. So the design and the models are dependent, again, as I said before, on program community needs and capacities, and our ability to meet the obligations under the Head Start performance standards. So this is kind of where the rubber hits the road in our community. These are the guiding principles of Head Start and early Head Start. And this is where the research and practice happens. So as you all know, just as we've worked together on Parent Aware, there is a very high emphasis on high quality and consistency in some of our program services. So we are looking at class scores of teachers. We are looking at what constitutes high quality in our mental health services. We are thinking about mental health consultation, curriculum assessment. There's a lot of things that have happened to explode in the research around early childhood that are calling attention on how we conduct those services in classrooms. At the same time, we still can continue our prevention and promotion activities by working hard to get our families into medical care, dental care, make mental health referrals, really emphasizing well child checkups and prenatal care. So a lot of things to make sure that families are healthy and well before they start school. Obviously in COVID, we've really realized the importance of the way we build relationships. And we were so thankful that COVID hit in March and not in September, so that we had an opportunity to do face-to-face meeting and greeting and getting to know parents, because it really helped us in March when we had to go virtual for a while. And we continue to think about best practices in parent engagement, inclusion, and cultural competency. As all of us know, what happened in Minneapolis this summer just rocked our world. Looks a lot like 1964. And we have to question whether our practices are really meeting the needs of our culturally diverse population. So I would just say that this is a work in progress that we do with our partners and with all of you. And the idea is to have the highest quality standards and service for the families who need it the most. And another partnership we have with all of you is this idea of workforce. 2 years ago, we had a workforce summit, I guess it was in 2017 or 18, when we were really asking all these questions about how we can not only support a very diverse workforce, but how we can pay people better so that people will want to come into our field. This slide was created for that meeting in 2017, where we showed that about 30% of the population of our teaching staff is culturally diverse. We're proud that that's quite different than the K-5 school system, but we still feel we have a lot of work to do with over half of our children being racially diverse. That said, we also know that we need to drive professional development. And so we are constantly thinking about how we can support our staff to get degrees. And we have noticed a challenge in that more recently, because not as many kids are going into the early childhood field. And so with the demands for people with these degrees, we struggle to be able to meet that demand of having at least 50%, well, we have over 50% of our teachers with either an AA or a BA, but we would like to see that even, these percentages be even higher. And so we use our training and technical assistance dollars to incentivize education, to provide scholarships and other financial assistance to help our folks achieve these degrees. So I don't know if I talked really fast or if I'm on time, but this is kind of the sum of what I wanted to say about Head Start. So this is what we consider to be success: a healthy, empowered family, children meeting developmental milestones, children and families who have access to mental health care and up-to-date well child checks. They have had their immunizations and they know who their doctor are, and hopefully they have a dentist would be my goal when I finish with this job. It's never going to happen, and we have pregnant women who have prenatal care and education. So we see it as a whole package. All the components are important for success. And after 55 years, we know even more that, that these families deserve all the best practices that we possibly can give them. And every child, if we do our job right, can then reach their full potential. So that's about all I have for you today. And I'm happy to answer any questions. And I think there's a few other people on the phone call that probably can do that with me. So I will stop sharing.
So please feel free to either put your questions in the chat or go ahead and speak up. I was wondering if Jeannie, if you wanted to show yourself and introduce yourself to the group, that would be terrific. Glad to have you on as well.
Thank you. Thank you, Gail. That was really great. I just love being part of this Head Start community. My name is Jeannie Dickhausen, and I have been, I currently work as the Head Start Collaboration Director at the Minnesota Department of Education. I am a former Head Start parent, and my daughter was in Head Start in St. Paul in 1994. And I was one of those parents that just took advantage of all the different opportunities to attain goals for my family and became a staff person in school, and now here I am with all of you. So I'm really passionate about this program, and Gail, you did a great job talking about it. I mean, it's so hard to, just fit all that into 30 minutes of 55 years of just wonderful things for children and families, but you did a great job.
See.
And I look forward to another 20 years of working with you.
Yeah, right. No.
So while we're waiting for questions in the chat, I don't see anybody coming off mute, but please feel, oh, here we go. How is enrollment going in HS right now? What happens with HS funding if spaces are unused due to COVID? Also, I know the start of voluntary pre-K had big impact on enrollment of 4-year-olds. Has that rebounded?
Yeah, so I did a survey of Head Start programs right before the school year started, and they reported, I had 3 programs, small programs that didn't reply, but they reported about 80% capacity for enrollment. Now, whether they've realized that, I am a little doubtful. The feds suggested that we try to re-enroll the students that we had last year and then take it easy in terms of adding a lot of other children, because we needed to have this, they wanted so much for us to be face-to-face, and we needed the space to be able to just social distance. So I would say from, anecdotal information that we're somewhere in that, 60 to 70% enrollment. And at this point, we're not pushing hard to see that all seats are filled and providing as much face-to-face services for the children that we currently have. As far as rebounding in 4-year-olds, well, you're absolutely right, Lori. We are probably we still have more 4-year-olds than 3-year-olds, but it's getting close to 50-50, which actually, based on some data that we've looked at for long-term results, suggests we're going to be able to get those kids hopefully for 2 years, and starting earlier is definitely to children's advantage. So having more 3-year-olds is really not a problem, and it's one of the reasons why we're also shifting more slots to early Head Start.
So maybe we can stick on the COVID theme for, oh, I'm sorry, was there somebody else who wanted?
This is just Lori. Thank you,
Yeah.
Gail, for that. I just have one question then. Do you lose that federal money if the spaces are not filled with kids?
No, not this year. They've relaxed all those regulations, and they're not counting. Again, there's still a lot of accountability to make sure we're trying to fill as much as possible. But unless there's another CARES Act, there's still a lot of unmet financial needs. It costs about 20%, at least 20% more to operate during COVID. So the feds are being quite flexible in terms of how we meet our performance standards with the children that we are able to serve.
So sticking with the kind of COVID changes, there's a question about virtual provision of care and how that is going, expecting increases in COVID cases, and how you're dealing with the digital divide.
Yeah, we learned a lot from March to May. We learned what families didn't have reliable internet access. We bought tools for families. We bought data for families. We were working any which way we could so that we could have a virtual visit with them. And I think that's part of the information we're gathering when we have new enrolled families. It's sort of what's their connect capacity. And we've got a lot of new tricks in the trade, apps and things like that, where people can do text their teacher right off their phone. So we put a lot of effort into figuring out how to be able to connect virtually with our families. But we also are doing home visits in person for early Head Start, and we mask up and try to find a safe, it's not always in the family's home, but we find a safe, clean space that we could meet. So we're doing our darndest to see if we can be face-to-face with families and kids.
Okay, sorry, everybody. So there's also a question about Head Start and childcare partnerships, whether those have been increasing, and anything you want to share about those partnerships.
So those grants, so we have 380 children in official early Head Start childcare partnerships. I think, Jeannie, I looked at PIR and we had around 115 kids in family childcare. It might have been higher than that. I'd have to go back and look in traditional family childcare partnerships. And then some of the programs are working, for example, Ramsey County works in a childcare settings where they're partnering that aren't called official EHS childcare partnerships. So those are partnerships that have been here on the books for a long time, but they would be marked in our center-based numbers. So are they increasing? The grants that we'll see, there was a competition for early Head Start expansion. I know a number of our programs went for that money. We'll see if anyone in Minnesota gets it. They're expensive, but certainly we're eager to serve more children full day, full year. And so if we can't do it in partnerships, we're also trying to offer those services directly in our centers as well.
And Gail, I just have the PIR for 2019 pulled up, and we had 372 enrolled slots at center-based childcare and 488 at family childcare.
Thank you. I knew it was bigger than that. Yeah.
So can you say a little bit more about whether there are families that want to access Head Start that can't because of lack of funding, or what the other barriers might be? And if so, this question from Lars, what would it take to expand Head Start access?
Right. So as I said, we are only funded to serve a certain number of children, so we are not able to serve all of the eligible. And so that's why we often report waiting list numbers. And I think over the years, it seemed like, I think people quit counting at about 5,000. We know that the income eligible population for particularly early Head Start we're only serving about 10% of the eligible need. So how do we get more funding? Well, that's my job and all of our jobs and every parent that we can touch to advocate on the federal level and on the state level to increase our funding. And I think we've been pretty successful. As I said, we're about a $10 billion program right now. It would be awesome if we were fully funded so that any child in poverty could walk into a program and be served. Because we do have we can't serve everyone. That's why we have risk criteria. So that is also why our program, the children that we do serve, may look quite different from even the average child in poverty. And if you would help us advocate, we'd appreciate it, because we would love to serve more children.
Can you say a little bit more about, this is a question from Jane, but I also had a question about what it takes to become a Head Start site. And, is there TA available for that? And how is it decided? Like, are people who are providers from Minnesota competing with from all over the country, or is there an allocation based on, some need, or how is it decided kind of at the federal level, which sites are funded, and how is that competition structured, and how could Minnesota do better if possible?
Right. So the grants that are currently out there in service areas are 5-year grants. And at the end of the 5-year grant, that the programs get a determination as to whether they have to recompete for their funding or whether they'll be allowed for another 5-year funding. So any programs that are determined to be recompeted go into another grant announcement. So every year you'll see grant announcements for service areas across the country who anyone can compete for. And in addition to that, anytime the federal government allocates expansion money, there's also a grant announcement with opportunities that are more like nationwide to compete for grant funding. So any nonprofit, for-profit, city, community can determine that they want to go for one of those grants, if it's in their service area or if it's a federal expansion. And what I'd say to them is, think very, very clearly about what you want to do for your community and design a program that meets the standards. And that while there isn't technical assistance to write the grant, although I will make an exception to that, when Lower Sioux wanted to write a grant, they hired some consultants. Lori Davis, you might know about this, but they hired some consultants to help them think through their grant. And, but once you get a grant, there is a lot of technical assistance to help support you to make sure that you are fully in compliance with all the standards and recommendations. So we love to have new grantees, and happy to serve them, particularly here in Minnesota, as they would also then become state grantees and be eligible for some of that state funding. But it's a real thoughtful process, and it's really community driven.
Gail, can I add that when people sometimes will call and ask how do they become a grantee, and I provide the information that you just shared, but I also say that if you are interested in a partnership with a Head Start program, that you should contact your local Head Start grantee, because they may have opportunities where they might need, they might be lacking in space, and partnering with a local childcare or a family childcare provider could be just what they need to be able to serve more children. So I always say that too.
Thanks, Dean.
So there's some question in the chat about the Oregon expansion. Could either of you address that?
Oh, Glennis. Yeah, well, Oregon's unique. Oregon had for years, the president of the National Head Start Association was an Oregon grantee, Head Start grantee. And he was really instrumental in leading his state legislature into really embracing the idea of fully funding Head Start. And so they have put more state funds into Head Start than any other state in the nation. And they have, with those state funds, and I can't speak to it entirely, but they allow state grantees. So they have enough money that they can actually support grantees who will have to still meet the same federal, the same performance standards, but are state Head Start grantees. So that's been one of their preschool development projects for a number of years. That's about all I could get some of my state colleagues to talk about Oregon at another time.
Has there been an estimate of what it would take to fully fund, to do that in Minnesota?
You know, Jane asked me to estimate what I thought it would cost to fully fund early Head Start, and it was somewhere around 440 million, right, Jane? Isn't that what I gave you? Just unmute. I think that was what I
That's right. Yeah.
Yeah, around 440 million.
Is that assuming a similar mix of kinds of programs? I assume some of the kinds of programs cost more than others.
Well, that was based on an early Head Start cost per child. So that's, yeah,
Okay.
Yeah.
All right.
which is,
So there's a question, a couple of questions about kind of the effectiveness of Head Start. One around kindergarten readiness, and another that Nancy had around which environments children do better in same social economic groups or mixed social economic groups, or does it matter?
you know, Nancy, I don't know that literature that well. I don't know, Jeannie, do you know that literature? You know, this
I don't
yeah.
off the top of my head.
Nancy, I don't know that could speak to that. I think there's a lot of, some of that may be coming out with the state pre-K or the New Jersey models. Some of the places where Head Start and school-based pre-K are mixed. But I don't know, maybe Lori Davis can speak to it better. I'm not sure I can speak to that research.
No, I mean, I
How
think I
about-
might be able to dig something up, and if I do, I'll send it to Deb.
Yeah, thank you.
Okay, that'd be great. I can forward it on. How about the kindergarten readiness
Well,
question?
I could show you some data that we've done. I have a couple slides. I don't know if you want to see that. Okay, let me go back to my slides. I saved them for later. So we have, we've taken 10 years of data that or I guess it was 8 when we matched in 2019, and to match into our, where kids were in their K-3 experiences. And we matched 20,000 kids into about 1,200 elementary schools and matched them with their peers who were eligible for free and reduced lunch in the same school. So we matched kids with kids that were in their same schools. And what we found was that from that data, that Head Start children's performance on 3rd grade math and reading scores were comparable to their school peers. So, and you should be aware that when we say school peers, these are peers that were eligible for free and reduced lunch. So higher income than most of the Head Start children. We also found that if children had 2 years of Head Start or early Head Start, they were achieving higher on 3rd grade than those that had 1 year. And multilingual children who had 2 years of Head Start were also doing better on passing the access test slightly earlier. And then the most important finding that we were reporting on was that attendance was huge. So the Head Start sample that had better attendance than their school peers, or the Head Start sample had better attendance than their school peers, but children who had high attendance in Head Start were outperforming their peers in both math and reading. So attendance in Head Start was predictive of attendance in K-3, and good attendance was really a driver of outcomes. So in terms of transitioning into kindergarten, getting kids early, making sure they have, their parents understand the value of getting children in every single day, some of the really, what we found, drivers to better outcomes. We have a whole lot of other data from this study that I'm not going to show here now, but I think it was really helpful for us to start seeing what we can advocate for in kindergarten transition. And so we're working with the Department of Education. We worked with them last preschool development grant, and we'll continue to work with them using some of this data to inform kindergarten transition planning.
If you send me slides or links or whatnot, I can share with the group for those who are interested.
I think I sent you the fact sheet that had the results I just showed you.
Great. Okay. So that went out with the last meeting note. So
right. And for more, if anybody wants to see the more in-depth study, we can. I'm happy to just email me. There's some interesting findings on early childhood special ed and special ed that I'm still pondering on. So be happy to talk to someone about it.
all right. Any other questions? Otherwise, thank you so much, Gail and Jeannie, for being on. And I guess there's some other former Head Start teachers, Lydia, among the group. So Thank you.
Welcome. Well,
Thank you all for sharing. And, Gail, I know many people probably know how to reach you, but I can also share your email if there's some follow-up questions, Jeannie as well, from the group.
sure.
Then I'm gonna, sorry, go ahead.
No, just send it along. I'd be happy to answer any questions.
Great. Well, thank you both. This was really, really helpful. I learned a lot and excited to continue to think about how this piece fits in with the whole. So I'm going to stop recording for now.